In order to do the admission paperwork, simply click on Patient File, search for the patient either via UR number or patient's name. In this case, we'll just put in the UR number, and this patient has been known to OpenKIMS before, so we use this patient and we click on Admission. Fill in the appropriate and current GPs and details. And please notice that there is a reuse button. When you click on that, you would reuse the last entry in a field with the same name. You can do that for all of these fields over here, either presenting complaints, the medical history, surgical history, family history, and so forth. Please do not forget to put in the height, i.e. 180 centimeters, and the weight of, let's say, 80 kilos. And also ask the patient for any significant comorbidities, i.e. ulcer disease, myocardial infarction, and so forth. Make sure that you save this form and continue for the clinical examination. For the examination, you will notice that there are buttons available. Click on these buttons and you will see that there is the facility of common phrases. Now, these common phrases are assigned to a specific person, and you will notice that when you first log in, you won't have any common phrases available. In this case, you can use the phrases of your unit, and all the common phrases of your unit will be shown. So in this case, we want to use a normal short neurology, and you would go in there and just change the bits and pieces that are specific to this patient and that you have investigated. For previous investigations, we usually put in MRI or CT results that are important to know, and then you can put down your diagnosis, i.e. L5-S1 disc prolapse. There we are. And you can then enter the treatment plan for the nurses, i.e. bed rest, get MRI, etc. Make sure that you save that before you leave this thing. And you see that here this entry has been now marked blue with the status registrar. This status and this color is actually related to this drop-down list down here. You can keep it as a registrar if you still want to do something with it. You can send it to the secretary if this is for her to correct things, or send it to the consultant for him to have a look at it as well. However, if you feel that you are done with this form, you can mark it as OK. I'll just keep it as a registrar for the moment in order to show you that this is an open form now, i.e. a form that I still need to do something with. How do I know that? If you go back to your entry screen, you will see that my patient here has its admission, and you again realize that the color tells you the working status. So once I'm finished with this admission, I would mark it as OK and save it, and you see it's green. And when you go to your entry screen again, you'll see that it's not in your open forms again, but it's on your last 20 forms of mine. Once you finish the admission, you obviously want to print it. The default print layout looks like this. And this is the print layout that everyone will see who's not owner of this form. In regards to the specific permissions, I would like to refer you to the screencast permission system. There are, however, some other printout forms available. Here at Southern Health, we do have a specific form which looks like this. So you can have different printout forms, and if you have a specific form provided by the hospital and you would just want to print in that form, you can use that one as well. Make sure that you print this out, sign it, and put it into the patient file. You can use or you were supposed to use this form at the pre-admission. So let's assume that you pre-admitted the patient today, and you would know the admission for tomorrow, for example. You could do that as well. If this obviously was at some other date, you would have to adjust these dates accordingly. There we are. Put down the consultant who's in charge for this patient, and if you know the ward bed already, you could put it down in here as well. Save it, and there you go.